Rhubarb here today. And Rhubarb has a history of chronic kidney disease, which is very common in chameleons, and potential gout based on her historical records. And she presented today because her legs are turning black, her joints are swollen, and she has some superficial ulcerations. If we look at this back leg, you can see severe swelling all around this joint here. We've got some developing in the front. If you look at her little mitten, we have swelling right here. This joint is sensitive to palpation, so there is discomfort there. You can see we have some skin wounds. She also has some lesions on the other toes on the skin. So the skin is not hard or necrotic, it's black pigmentation changes. Chameleons can change pigmentation with stress, with metabolic diseases. Certainly in response to pain, we'll see skin pigmentation changes. Very common if we give a chameleon an injection, they'll actually get a black spot where we give the injection, so it's expressing discomfort and stress. And so the worry is that she has potentially joint involvement with the gout, which is very typical, and that may be causing her some pain, and it's causing some color changes. Earlier photos of her show the white basically to this level, and all the distal limbs were pink. She's had the same owner for several years. She was adopted as a sick hatchling, and he's been able to get her to this point, which is quite the feat because chameleons are very delicate in general, but this is a difficult disease. Chameleons are very predisposed to kidney disease. Reptiles in general are. Oftentimes chronic dehydration plays a role, so with our chameleons keeping the humidity levels up and keeping drip water, which they only drink from a drip over the leaves and not from a bowl, is very important. Over supplementation with vitamin D can cause mineralization of the kidneys and can be a very big problem for them as well. And then having a lack of vitamin A can result in the interior of the kidneys, the cells, actually changing, and can lead to occlusion and failure of filtration in the kidneys. And all of these things will cause uric acid to build up in the body, and those uric acid crystals are often deposited into joints. And this is often a terminal condition, and it can be very uncomfortable for them. It is uncomfortable. The other differential I would consider is a septic joint, which I've seen in many chameleons. The appearance is often multi-swollen joints, multiple joints that have swelling, and it's often over the larger joints. And that can be from general immunosuppression in chameleons, leading to secondary infection and blood-borne bacterial infections, which then seed the joints. But the big concern in her is her kidney function and the sequelae or the potential of gout. So we do have labs pending on her. The next step would be to get radiographs of the joints as well. That's Rhubarb.